Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Lee Hicks, who is an oncologist with Baptist Health. Welcome.
Good to be with you.
Now, I use the word oncologist. That means cancer, and everybody hates to hear that word. But you're getting really better at treatment, and there's some new stuff. So tell us a little bit about the new stuff.
Yeah, I've been doing this for 30 plus years, and if you'd told me that at that time we would be talking about immunotherapy as the primary focus of our research and advancements, I would have said you're crazy. But what we have learned over the decades is how to marshal the body's own immune system to come to the attack. When you think about it, all of us have probably had cancer through our lives, but your immune system surveillance cleared it. And it's only when those, I call them to my patients, I call those the T-cell bloodhounds that sniff around and are supposed to find viruses and other attackers, but also cancer. But at its root, that's the problem. The surveillance system failed. Well, with immunotherapy, we're able to enhance the immune attack, and now at Baptist, we were among the first in the state to be a part of doing what's called bispecific T-cell engagers. And if you want to think of it this way, if the T-cells are the bloodhound of your immune system, but the problem is the bloodhound can't find the cancer fox, then what you want to try to do is help the T-cell smell the fox. And what bispecific T-cell engagers do is it takes a molecule, and you can see it on that cartoon, the little purple thing there. On the one hand, the molecule is reaching out to that T-cell bloodhound, and on the other hand, it's reaching out to the fox. And what it does when the cancer, which is hard to find to your immune system, now can have trailing out in your system an antigen that your T cells can sort of smell, then that T cell bloodhound can finally find its way in to attack and kill the cancer. And so that's the biggest problem over time, is our immune system failed. Now we're able to make a cancer that's been invisible to your immune system now visible.
So you just talked about making your own body and your own body's chemistry to fight a cancer. You use chemotherapy, radiation, a whole lot of other things, but you also use a little faith. I know that you do that. So tell me, there's research that says faith really does make a difference.
Yeah.
Tell me about it.
I mean, first of all, at its root, if my average patient is 50 years old, then within 50 years I'm going to fail all of them at some point. And so for me, my practice of oncology allows me to bring answers that go beyond medicine, that in some ways I'm a little like that little molecule. I'm just trying to reach, on the one hand, to give the answer in my mind, which is Christ. I'm not ashamed of the gospel, and on the other hand, to those that need to be found. And what I find with this, even in people, this is not beating people over the head with my faith. I'm not a Gatling gun. I don't share it at every visit, and I don't say it all the time, but I am open to the Spirit to lead me when to reach into someone's life, when they are at some of the worst moments in their life, when medicine starts to reach its limits, or even when we are in the midst of where there may be multiple options and we're needing discernment that goes beyond books and algorithms, where in my prayers with the patient and in my own prayer time at home, there can be just a sense of which way to go. And it's just remarkable how the Lord guides my patients and how much they have ministered to me, and my patients have ministered to other patients. I've had patients who, it's probably not HIPAA compliant at all times, but I ask their permission, but I'll have a patient in this room who has been through something that when I'm walking into this room, I know this patient has been through it, and I'll get them together, and they will get together in my office in real time, not just at some meeting. I'll get them together right then, and they will pray together. And there's a lot of healing that can come from the most effective healer is the wounded healer, the person who can understand where you've been. And so patients in many ways help me do that best with other patients. And so it's not just my faith towards my patients, but connecting my patients with each other to help each other.
And those, you can actually see the benefit, whether it be at a peace or making a decision. And sometimes those decisions are life-changing and are life-ending and are life-beginning.
Absolutely.
Well, thanks for all you do. Thanks for the care you give your patients, both from the faith end and from the medical end.
It's great to be with you.
Great job. Thank you
Thanks,
so
Jeff.
much.
Appreciate you.
We'll be right back.